Mothers and Others for Clean Air, a program of the American Lung Association of the Southeast, is a unique partnership of leading public health and child advocacy organizations in the region.
Mothers and Others is an advocacy group that seeks to bring together people who are interested in the health of children around the issues with air quality.
I co-founded Mothers and Others for Clean Air with Stephanie Blank because we were both mothers of young children and we were very concerned about air quality and the effects that it has on their health.
We are based here in Atlanta, but recently began an expansion to include our neighbors to the north, which is North and South Carolina, because the issue of air quality isn't confined to any one particular geographic region.
Children are at high risk for a couple of reasons. The biochemical processes in their body that detoxify pollutants like ozone or sulfur dioxide are immature, they're still developing. Also, a child relative to an adult has a greater time spent outside because that's what kids like to do is play.
The main initiative is to help educate anyone from parents to caregivers to politicians, whoever is being touched by air, which in this case is every single person, about what's happening with our air quality.
Everyone's health is affected by air pollution, not just children. Older adults and those with chronic diseases or low incomes are among the millions of people who also face a higher risk. Chances are, you already know somebody whose life is impacted by poor air quality.
My name is Laura Kalaki, and the breathing condition that I have is COPD and chronic bronchitis.
My name is Terry Coker. I have alpha-1 antitrypsin deficiency. It is a form of emphysema.
It affects me every day. It affects me if I walk to the mailbox to check the mail. It affects me if I try to swim a lap at the pool. It affects me if I load the dishwasher. I mean, it affects every aspect of my life.
It's devastating. That's what it is. When you're so used to doing anything and everything you want to do.
Ozone and particulate matter, particularly in heavily populated areas, are very big problems. That bad air quality gets down into our lungs. We know that it causes inflammation of the lining of the air passages. Asthma itself is a disease of chronic inflammation of the airway. So if you lay upon this the pollutants from the outside causing increased inflammation, that's probably the mechanism by which children get into trouble with asthma.
Other kids, they look at me different most of the time because it's like, why is she always sitting out? And it makes me feel like, it makes me feel like sometimes that I'm not regular, but I'm not different just because I have a lung disorder.
There has been significant progress in air quality regulation that gives us hope for a cleaner, healthier future. The Clean Air Act administered by the U.S. Environmental Protection Agency is the single greatest reason that we are breathing cleaner air today, and it will continue to deliver significant health benefits.
We were able to raise about $10 million in partnership with the Georgia EPD, that's the Georgia Environmental Protection Division, to clean up dirty diesel burning school buses.
If you've ever stood beside a diesel bus and watched what comes out, it's pretty shocking, and you wouldn't want your child standing next to one of those old diesel buses.
The ideal situation for our regional communities would be that we would work together and figure out how we can all contribute to cleaner air.
If you want to get involved and help with this issue of air quality, it's also very cost efficient. It helps save money as well as saving our air. So things like carpooling,
switching out those light bulbs from incandescent to LED,
walking to things that are within a short distance.
We like to encourage the public because every man, woman, and child can contribute something.
Healthier, cleaner air is within reach thanks to the efforts of Mothers and Others for Clean Air, the American Lung Association, and supporters like you. The U.S. Environmental Protection Agency issued cleaner fuel and vehicle standards. Once fully implemented, these clean air protections will save up to 2,000 lives and prevent 19,000 asthma attacks and nearly 300,000 missed days of work and school each year by 2030.
I think one of the things we have to realize, we adults make decisions or not make decisions that impact the children. It's the pressure on legislators, it's the pressure on industry, but it's also holding ourselves accountable and being smart in terms of, because we're all breathing the same air.
Clean air equals healthy children equals healthy communities.
Support. Get involved. Follow Mothers and Others for Clean Air on Facebook and Twitter. And go to mothersandothersforcleanair.org for more information on how to take action to help protect the health of you and your family.